Well, welcome back. I hear a few of you went to the bar to have a glass of milk or something at lunchtime. So congratulations for doing that. Our next session is Community Paramedics and the Social Determinants of Health and about navigation. And Dr. Tanghe.
Yeah, I'm Pete Tanghe. I come from Minnesota, and I'm excited to be able to talk a little bit about social determinants of health. My background is not academic in terms of teaching, but just being a fan of academics. And I currently am the medical director of a community paramedic program at North Memorial in Minnesota, and has been almost a year now working with them. Prior to that, was working and started a program at a different agency, and then have a clinical practice in emergency medicine and board-certified emergency medicine and EMS physician. So. And then first to start off, I've over the weekend had a fun occasion to have conversations with some friends from Southern Hemisphere, and at the end of it, they're like, well, aren't you going to apologize? And I said, what for? And they said, for your president. So I'm just going to apologize real quick. Sorry for any consternation that we're causing people. So that's the elephant in the room. At least that's what it feels like for me. And I'm headed after this to visit my family in Belgium, and I know that'll keep coming up. So sorry. Social determinants of health. I think I came to know this term somewhat when I was going through medical school in the late 90s. I think we were starting to talk about this a little bit, but I certainly didn't get any additional training in it. Certainly nothing required. I worked with some immigration health in New York City and started to be exposed to these concepts, and I think now at least my awareness of them is increasing over the last 4 to 5 years, and I think it ties well to what we're trying to do with community paramedicine. And so why should we care about it? I think it helps us think more broadly about the work that we do, and certainly now that I'm working in community paramedicine, I realized that 25 years ago when I was an EMT in a small town in northern Minnesota, when we would not go back in service or run by someone's house who my partner knew about, who had lived there forever, we were doing community paramedicine, but we were kind of doing it illegally, but it was pretty fun. So I think it helps with that sort of change the mindset of looking at problems different. You know, the problems that we've been doing every day the same way, looking at it different. I think the idea of value proposition is really important. So like some of the slides have shown, where the hospitals and some of the people who will be paying us to do this work, they're really starting to think about the social determinants of health. And then I just like how social determinants of health, which I'll give you my definition in a moment, but I like how it really provides an intersection for public safety, for wellness, for public health. So to me, it's an answer to that question I remember asking 15 years ago about, are we, for our EMS work, are we public health or public safety? And I think this helps answer that question, at least from my point of view. So the goal is real quickly to mention social determinants of health and then and describe how we're addressing them in our program. And so hopefully at the end, you'll be able to list 2 social determinants of health. Appreciate the cultural perspective, and then think of ways that you can impact that as you head back to your own work. And this morning already had a couple new ideas, so I'm really happy with the conference so far. For me, I think social determinants of health is sort of like the comment from earlier about EMS, or if you've seen one community paramedic program, you've seen one community paramedic program. I think social determinants of health in a similar way. I don't think it's clearly defined. People put pieces of it out and call it different things, but here's a busy wheel. And then if I was better at research, I'd like to do is see how much PowerPoint is the new acronym, and if people just determine enough social determinants of health to fit whatever the PowerPoint template is. So here's a couple of those. And then again, back to my earlier apology, one thing that really was a epiphany for me or blew my mind like a year and a half ago, at least from a perspective of an American, is that there is a distinct difference in language between, in our case, it's Republican versus Democratic, but I think in talking to friends from other places, it's kind of a liberal versus conservative point of view. And the point being that if I go into a meeting and am coming from a more Democratic perspective or liberal perspective, if other people in the room are from a conservative perspective, the language might set us up to fail. So what was really interesting, and this is based out of research that the Robert Wood Johnson Foundation did, is highlighting how, again, in the U.S., a Democrat thinks of things in terms of equality, or that an imbalance of health is unjust. So if I'm having a Democratic moment and come in all convinced that my community paramedic program is the right thing to do because it's affecting justice, if I'm speaking to someone from a conservative point of view, they would say, well, that's just a natural state, so that's why I'm not going, I don't have the same motivation to pay because that's just the state of things. And vice versa, I might come in and build a case that says this is really addressing just a natural inequality. So some people are going to not do well and some people will, and that's my perspective. It's good if I'm having that Republican moment. But if I'm speaking to a Democratic funder or payer, that is where our program's at, then that might not speak and motivate them in the same way. So my point with this slide is not that one is right or one is wrong, but that to me it was a real eye-opener because I just thought, well, doesn't everyone think that that this is how healthcare should be? And the fact is that there is probably a leaning based on your person's perspective of whether or not it's a justice issue or a natural state. And I think we can translate that to when we're trying to think about motivating our patients too, to understand what their perspective might be as well. So if I bring something up that either that raises a question or that you want to point out a difference that might be more applicable to someone from the UK or Australia or Netherlands or wherever, please feel free to point that out. But again, this I think probably really opened up my eyes quite a bit to some of the struggles we were having. So, and again, I'll leave it at the end of the talk some mentions if people are looking to learn more about social determinants of health. I've had good luck through some of the online courses, and there's that academic piece where, again, you can sit and talk about the 5 social determinants of health or whatever, but then trying to get it to translate into the real world is, I think, the really fun part about me, and I think a fun part about the work that I get to do is that I can come to a conference here, and we can be texting then during break or lunch to the medics who are working back home right now and say, hey, do something different. So I think that's the fun part about this kind of work. And so here's the social determinants that I think of. And it's essentially describing the ecology. And again, this is a theme I heard in a couple of the other talks, understanding what are the needs you're trying to meet. Are you trying to offload free up ambulance resources? Are you trying to address food or a place where maybe you don't have the same senior services that somewhere else might. So, and that it comes back to that community needs assessment. This just is the concept of community paramedicine that I work out of, and it's this notion that there's an umbrella of community resources that exist. We all have them. They're all different. There's a population on one side, and there's different ways that you can define a population. There's all these services on the left side, and it can be a variety of different things, a hospital, or I think since a year ago, since I used this slide, I think adding in that other healthcare asset, which is, let's see if I change this. I would make this circle, I think, is getting bigger and bigger for us as we start to think about the services we're providing, that maybe the true partner isn't the hospital, because maybe that's not really the best health place, but maybe the true partner is the YMCA or a grocery store or someone else where health is really occurring. And then I'm really fortunate to work with a really solid group of community paramedics in Minnesota, and then we work together side by side. So I see the medical, back to, Pierre's not here so I can say it, but I think I see my role as a medical director, not as a director, but as a partner and we both have different skill sets, and together we become a really powerful team. And then the telehealth technology piece being what helps us bridge things. So community needs assessment, like Gary was talking about. And my point here is that, we've done our community needs assessment. It's a dynamic process. I think we're able to create a pretty good lay of our land and where, what the needs are. We're learning how to do that to help other people do a community needs assessment when they approach us for help with a problem. But the other fun thing for us, being 3-4 years into our programs, is the patient is really a tremendous teacher about what are the needs, because it's that academic versus real world piece where we have the academic idea of, here's this clinic works here, there's the senior services, there's the pharmacy, there's whatever, all these resources, and then the patient is the one who we really need to do that needs assessment with, and to help them learn to navigate the process. So this is one of our senior medics. This guy's done, I think, everything you can do pretty much in EMS, and it's he's just really gifted at sort of representing both the patients but also our group. And then one of our patients, and I think we keep learning, this patient had X problem, we found Y and Z solution, and now that we're beginning to develop some institutional knowledge, we're able to say, patient C now has the same issue as X, so we're going to connect them with Y and Z. And that's where I keep coming back to that one circle of the community or the other healthcare asset becoming a bigger and bigger circle, because we realize, the Y's got a diabetes educator or whatever it is. And so back to one of the social determinants of health is food and food insecurity. In Minnesota, we're well fed, but we have some other issues. And I think what's interesting here is our unemployment rate has been dropping, but our food insecurity needs have been rising. So I think it reflects other costs of living that people have. And so this is, when I worked on the streets more, I remember passing the hat for a collection. You'd run into a patient, an individual, and there'd be some situation where they didn't have food, or, the kids didn't have the right jackets or whatever it was, and we'd pass the hat and everyone put things in. So in my democratic moods, I feel like that's not just. So it's not just to make the paramedics pay for that, and it's not sustainable. So one of the things that we've been working on is how do we address food insecurity? Because again, a lot of times people would pitch in and buy a bag of grocery and leave it for the patients, but not affect a long-term change. And so we found a partner, and this is a nod actually to we're in Minnesota, again, a couple different community paramedic programs. I would encourage people, if you haven't been doing this, to connect with the other people in your region who are doing the community paramedicine, because one of our partners at Alina Health was able to set up or found this group that does emergency food rations that are designed to be shelf stable and are designed to connect people to a local grocery with a food card or whatever. And so our holiday party, we went and made some boxes, and now we have that resource available. So it's been good, and we can divide it up into like a bag that for like someone who's homeless, we can give them a small bag that they can put into their jacket. Or if they have a house and just don't have food, we can give them 20 meals. My hope, this is a new service we have. my hope is that we get to the point where we're starting to cook with the people in their houses. So showing them not only here's the box, but let's go through and cook. And I forget who was talking, somebody, but mentioning, yeah, like showing them how to use the sodium labels on their soup cans or whatever to really understand how their food can impact their health. So that's been a good partnership. Transportation's huge for us. We officially don't transport patients, our community paramedics, but I think as a director, I know we put people in a tough spot because sometimes that's the true barrier to some immediate need. One thing that I learned from one of our paramedics, they started taking the bus with their patients. These were patients, we were taking care of a group of people from Burma. And so it was perfect. They had a big apartment building that many of them had resettled in. It was a 5-minute shot down the bus line. But for these folks who had just come to the country, didn't know English very well, just needed someone to take them once to show how to get to the clinic. And I thought it was a really cool leap that the paramedic took to say, you know what, I'll ride the bus with you to your appointment and back. Since then, I've known we do this more often now, and it takes a little bit of encouraging, because sometimes the medics have never ridden the bus before. So it's getting out there on the bus. But I think this is another interesting potential partner. Maybe next year we'll talk about how we're connecting with our bus company, not just the specialty or like the invalid bus company, but just the public transportation and having the medics help navigate through that. So. And our community partners really are critical to us. So we are fortunate. Pillsbury may be a name you recognize from food. It's a big food company. In Minnesota, we have a couple big food companies. So they have a foundation, and our community health workers are come from this Pillsbury group. And again, a really neat, a really cool way, and I haven't fully processed, but I love that whole concept of kind of the entry level being the community health worker, and then being able to have them help us do their work because they're coming from the building that we're working in, or the neighborhood that we're working in, and then being able to translate things. So I got to go visit a really fun older lady with one of our community health workers. The experience going into the house with the community health worker, who is a wonderful woman named Sydney. She looks and is grown up in a similar culture as to our patient. It was so much more fun for me to go in that way versus just going in on my own, or with just because of we talked about chitlins and all the things, all these foods that I wasn't maybe familiar with, or she maybe would not have been as comfortable talking about. And so that diet discussion was a lot different with our community health workers. So they're a huge, again, fortunate in Minnesota where we have a good group of advocates for this role, but I think connecting with them to address the social determinants is really helpful. Social workers, again, kind of on that other end of the spectrum where they're up with, our licensed social workers have also been really, really valuable partners. I think it's an interesting, I'm curious 2 to 3 years from now to see how this conversation is playing out at this conference, because I think my observation is a lot of our community paramedics are becoming mini social workers. And either our education needs to catch up to that part for them, or we need to become very clear about where we pass that task off to our social work partners. It's challenging. I don't have a good answer for it, but I know that the social workers, because when they hear and see the impact that our community paramedics are having with their patients, are really important advocates for us, and they've been volunteering their time essentially. And we're just starting to have a social worker who's going out on ride-alongs to see more how what we're actually doing, and figure out ways that they can impact better our work together. And So if you look back at the slide deck, you're not going to see anywhere the mention of pets. And on one of the slides, though, earlier today, there was a mention of the DVM up at the top screen. And so to me, I was happy to see a vet listed somewhere on the slide deck other than here, and hopefully maybe someone else has already got some experience with it. I'm surprised how often pets are come up for us. It makes sense thinking about it. You know, some of these folks are pretty lonely, and social isolation being one of the social determinants. Some of them address that loneliness through their relationship with their pets. Sometimes it's the issue of like hoarding, where we've had a couple people with way too many cats. But this cage is really interesting to me. This cage represents a safe new home for one of our patients, her parrot. I've had the occasion to feel threatened now with this patient with every species of animal in someone's house. But we have one of our patients, and this bird flies around her apartment free. She's never been in a cage, and there's bird shit everywhere. And she's a really interesting woman. She's Pete, you asked me yesterday if I knew a jet propulsionist, and she actually was a NASA scientist. So, but amazing. So this really, really wonderful woman, she's crazy, but she's wonderful, wonderful. Moved here, she's old now, she's retired, she lives in an apartment. She's got this bird who's lived, like, it's older than I am, I think. It's this gray parrot. And it attacked me in a bathroom because I really wanted to see it. I kept hearing about this bird, so I went to the apartment. It scared the hell out of me. But we're trying to help her transition, and we're working with, you know, her doctor, her care coordinator, all these things about saying, you know, it's not safe. It's not safe right now in your apartment. There's all these different issues: food, medication safety, fall safety, all these things. It's not critical now, but at some point it's going to be. If an ambulance shows up at your house, they're going to freak out because, again, there's bird crap and all this stuff everywhere. Our paramedic is not accepting of it as being normal, but she's comfortable going into that environment. And by working with the patient, she's identified that, yep, she recognizes. She recognizes something's got to change. She's getting older. But her big barrier is there's not a place for her bird to be. And so we've been really working hard to find a place that will accept her and her bird. And one of the requirements was having a bird cage. So 2 weeks ago, this is from Craigslist, our medics have been looking for the right bird cage and found it and got the right price. And there was a little collection of the group, and we all pitched in and bought her this bird cage. But to me, it's, again, going through all my academic classes on social determinants, public health, pets get a nod, but this is a real world example. And I think hopefully in 2 years we'll have someone here saying, here's how you deal with pets, and it's more than, but maybe, I don't know. The number of cats that people have is just remarkable to me. So, and maybe, yeah, go ahead, please. Yeah, thanks.
Well, maybe another example of this. I was a policewoman, so I came to the nice part of the.
Do you want to come up, Marie?
Oh, yeah. I'm from the Netherlands. I hope you understand that sometimes I have to find some words for the similar. For the things I would like to mean, and then I try to describe what I mean. I would like to give an example of domestic violence where women actually stay at home because of the pets, because they don't want to leave the pets, and the pets don't go to another place or can't get out, and they won't leave the house because of the fact that their dog they simply love has to stay in the place where they are actually being beaten down to death in a specific moment. And there is a special organization that is in the Netherlands that's actually taking care of the pets and asking for foster homes for the pets, for women and children that go out of their domestic or of the situation and go to a safer place for them and know that the pet that they have and love is actually getting a safe home also, and coming back to them at the moment that the house is safe for them again. So that's also an example of taking care of each other, I think. So I had to mention it.
Good. Well,
Thank you.
yeah. So we keep looking for our pet partners in the States, and you know, a lot of our measurements don't really address social determinants. Some do, but I think that's that's going to be important for us, especially with the value proposition. So here's some resources on social determinants of health. Again, my disclaimer is I don't have any financial connections, but I've really been enjoying Coursera. They have some really good offerings from different universities across the world. And then the Robert Wood Johnson, I think, is really they're doing a good work on these issues. So, any other questions? We'll talk about some. We get the chance to talk about some of our other programs too, or we'll highlight some of our other interventions. Go ahead, Pete.
Peter, we actually teach social determinants of health in our paramedic program right up front, and it really is a thread that goes all the way through. What we find is the students, when they start the course, think this is a complete lot of rubbish. And what's it got to do with being a paramedic? And it's not until they actually go on a few placements that they start to understand that, oh, I just saw that. That's what was in the class a year ago.
Yeah.
So it takes a while to sort of sell the whole concept, and existing paramedics, because they didn't do the formal training, actually don't have a form of words to describe what they see every day. And it's actually the social determinants of health.
Yeah, no, it's a great point, and I think, yeah, it points to the importance of getting this training.
Thanks. I'm curious, when you have a patient enrolled into your program that's not English speaking, how do you deal with that?
So, I learned this from one of the paramedics on the bus, and I've seen medics again kind of unofficially use Google Translate. They read into their iPhone. They hit play. The patient they speak into iPhone, and so we've used that. And then it's becoming one of our questions when we partner with new people, is saying, how do you need to cover interpretive services so that we're not incurring that cost as well. So we've used some phone interpreters. And then our community health workers, sometimes they speak a language too. Pete, you
also offer, just because we're on video representing North Memorial, we do offer full interpretive services through our clinic system. So if an AD patient needs it, they have the opportunity. But I think on the fly, a lot of people have used other means, especially in the 911 realm. So,
yeah. So it's one program I worked with. North is good if it's a patient from our health system. We use our interpreter for that. If it's working with someone who's not part of our system, then we look for an arrangement with an interpreter service. My funny story there is we had a medic, so with this Korean group of people from Burma, some of the other medics were really excited about the work we were doing, and so one of them went and translated everything, but into Mandarin Chinese. So I'm like, well, we're getting closer, but but it was cool just because, and Dr. Muir, to your point, the way I see that is the medics saying, before I got my community paramedic training, I'd go on a bunch of bullshit calls, and now that I'm trained in this, there's no more bullshit calls, which I think speaks really to that.
Just to follow up to the language barrier question, have you or plan to measure differences between patients who have language barriers versus those that don't in terms of outcomes for the community paramedic patients?
Not specifically, no. I think it'd be interesting. And I think that'd be another plug I would say, if there's someone who's looking for research projects but maybe doesn't have the people on this working as much, we'd love to talk more about putting our data in with someone else.
I have a quick question, just a piggyback on that. Talk to Ryan White in the back. He did all of our data evaluation for Eagle County, and it was one of the key demographics that we measured from patient number 1. So there's some good information there.
Thank you for your attention.